Hi, I'm Jesse Ahmet, your host of Valley News Now. The Medicare Advantage and Prescription Drug Plan annual election period is currently underway. Navigating the many options available can be really confusing for veterans ages 65 plus who are eligible for Medicare. And for the 9 million vets who turn to the VA system for care, many don't realize it's not an either or situation when it comes to coverage. So, here to explain are Darren Davis, Humana Veterans Channel Executive, and Mary Forey, USAA's Assistant Vice President for Health Insurance. Welcome, Darren and Mary.
Hey, thank you.
Darren, I understand this year's Medicare annual enrollment period is now underway, so Medicare could be so confusing. Can you tell us a little bit about what Medicare is and who is even eligible for it?
Well, sure. Like you said, we are underway right now. The annual election period for Medicare runs every year between October 15th and December 7th. And so this is when those individuals on Medicare can make changes to their plan for the following year. Individuals on Medicare include those people that are 65 and over, or they may have disabilities. Original Medicare is a government-managed healthcare program. And even within that space, you have private companies like Humana who offer Medicare Advantage plans, and then these plans can offer additional benefits to those folks as well, and help them uncover and close some gaps that they may find themselves in.
It's so nice to have that help because it is so confusing. So you work closely with veterans to help them understand their health care benefits. So if somebody already receives VA benefits, should they still consider Medicare coverage?
Yes, absolutely. So even the Department of Veterans Affairs themselves do recommend that our veterans that are using and receiving VA benefits, that they also enroll in Medicare if they qualify. Or if they're eligible to do so. And there's a couple of reasons they may want to do that. Number one, if that veteran wants to be able to go outside of the VA system and use a doctor outside the VA or another provider outside the VA, that's going to give them the option to do that. If that veteran wants to be able to use a different pharmacy outside of the VA, then they would need to select a plan that has drug coverage, and then again, they'd be able to use that network of pharmacies outside of the VA system. So within Original Medicare, there's a couple of things to remember. Original Medicare, again, being a government-run healthcare program, it's only going to cover around 80% of the cost. That beneficiary can really go to any provider that accepts Medicare in that area, but there's not going to be any type of max out-of-pocket or anything like that for them. Whereas with a lot of the Medicare Advantage plans, it's going to be a little different, right? They're going to have a network of providers they're going to need to adhere to, but they will have some max out-of-pocket protections and stop losses there as well. So a lot of things to consider, a lot of moving parts. So we highly recommend they reach out to a licensed sales agent in their area that knows the plans, knows the area, and can kind of help guide them appropriately.
Yeah, it's so good to know that there's help out there because it can be so overwhelming that then people just don't do anything. So, Mary, I understand that USAA and Humana have worked together for a few years. Can you share what brought these two organizations together and why this partnership makes sense?
Yes, absolutely. So USAA and Humana have actually been partnered since the early 2000s, and really it's our shared commitment to the military community that's brought us together. And if you combine the healthcare expertise of Humana, and as you were mentioning, it's very confusing, and you heard Darren go through all of it, with the veteran experience of USAA, that's what makes the partnership so powerful. And we are especially excited this year. All of Humana's veteran-focused Medicare Advantage plans are now going to be co-branded as Humana USAA Honor plans, and they'll be available to more beneficiaries in more locations. And these plans really were designed with the unique needs of veterans in mind. They're obviously available to anyone eligible for Medicare, which would include veteran spouses, but they were designed with the needs of veterans in mind.
Oh, such a good resource to have. And so, Mary, mental health is an important topic, especially for veterans. And can you share a little bit more about what some of the available resources are?
Yes, absolutely. Mental health is an important topic for all of us. And yes, especially veterans, as we know that the veteran suicide rate is 57% higher than the national average. And so getting that care for our full our full being, mental and emotional health. It even impacts our physical health. And so USAA, with support from the Humana Foundation and others, we've launched a coalition that we're calling Face the Fight. And the whole purpose is to raise awareness of veteran suicide and to really help break the stigma of asking for help. And there are resources available on our website, wefacethefight.org, that could help individuals if they are struggling. And, really, in all honesty, you can support a veteran just by, having an honest conversation with them, showing you care, and, providing support.
That it's so important. It really is, and I think it's good to try to break that stigma, and that's really a sign of strength and not weakness to know when you need help and get help. So, Darren, where can viewers and listeners go for additional information?
Medicare.gov is probably a great place to start. They can compare and contrast all the options in their area, and if you want more information on Humana's plans and products, just go to humana.com.
Thank you so much, both of you, Mary and Darren, for all the information today on veterans. And we can't get enough of that to continue to honor and serve our veterans the way that they have done for us. So thank you again for your time today.
Thank you.
Thank you.
And I'm Jessie Ammett, your host of Valley News Now.